My name is Michael Vigorito. I'm a licensed marriage and family therapist, and I primarily work with men concerned about problematic or out of control sexual behavior in my DC private practice, both on an individual and group level. I run two groups, a general OCSB group, and then a group that's more specific to gay and bisexual men concerned about their sexual health in recovery from meth addiction. I also am affiliated with the University of Maryland and their Prevention Research Center, where we are providing capacity building trainings and workshops to help behavioral health providers and organizations to integrate LGBTQ plus affirmative practices into their systems of care. And I guess relevant to this weekend training for Shaw, I'm also the co-author of Treating Out of Control Sexual Behavior, Rethinking Sex Addiction, which is a sexual health approach to working with folks concerned about sexual behavior problems. I think it can be a helpful experience for folks so they can find ways to think critically about this issue, because clients will be coming into therapy, or people will be asking trainers about this concept of sex addiction, or clients might be concerned that their behavior is addictive. And therapists need to be able to provide therapy in a way that, one, addresses their concerns, but also thinks critically about the narratives that people come into therapy, or maybe they will be working with in their classrooms. So this presentation will be talking about an approach that is not grounded in the addiction model or a disease model understanding of sexual behavior problems, but more of a sexual health approach that is grounded in an ethical framework around sexual health to help to do two things: to help clinicians think critically about when they are intervening, but also to help clients to think critically about their sexual choices, right? One of the things I like about this discussion or this approach is that I'm trying to help clinicians or educators to get out of this binary of what is healthy, what is not healthy, what is good sex, what is bad sex, but rather to help clients think critically about the choices that they are making that takes into consideration the context of the behavior, the motivations of the people who are involved. So they're the ones with, in collaboration with the therapist, who can come to a decision about what is sexual health for them, but also knowing it's not a boundaryless space. Like, therapists have a role here in helping to facilitate a process for our clients. So this is what I think is one of the strengths of this weekend, when I'm excited about helping clinicians and educators think through. I feel like there is stigma throughout this topic in in multiple ways, right? There's stigma attached to just having a problem that involves sex. I think there's stigma attached to the type of sexual interests that people have, right? The more unconventional something is, the more likely someone will have internalized some of those negative social or cultural judgments about sex. There's stigma around different classes of people who we tend to desexualize, right? And that just empowering them to think about sexual pleasure, I think, can be a challenge for folks. And so what I hope this training does for people is it helps them understand when and why to intervene with a client, right? That what I like to tell people is this is a kind of a sex positive approach, but a sex positive approach also isn't boundaryless. And I think sometimes clinicians get caught up in when I should be intervening because I don't want to come across as sex negative, or people might overly intervene because they're having this negative reaction about what is being shared, right? That their intervention is more driven by this ick factor than it is based on anything related to consensus understanding about what is sexual health. So I'm trying to help clinicians on both sides of this spectrum, so they don't under intervene. Is that the way you put that? They don't under respond. I think that's better, and that they don't over respond. Right. That we're trying to create this space where in the kind of the spirit of collaboration and honoring a client's sexual autonomy, that people can come together to understand what is sexual health and what is going to be both responsible, or I should say what is both pleasurable and safe, right? This is kind of the concept of responsible sexual behavior, managing the tension of these two things, something that's pleasurable and something that will hopefully be safe or less harmful in the long run. I'll just pick one of them. One of the presentations in therapy that I really really excited to work with or just to help are the people who have some of those unconventional sexual interests, right? And being someone who identifies as a gay man or a queer man, I see a lot of similarities in the process of coming out. The process of coming out as someone who has kind of an unconventional sexual orientation is kind of the same process of someone coming out with kind of unconventional erotic orientation. So that process of self-discovery, of labeling, of working through shame and helping people to feel empowered about asserting their sexual needs and desires in a way that feels safe and authentic. To me, that is just, it's probably one of the most rewarding aspects of this work. So if I can help clinicians wrestle with some of the negative reactions or countertransference they have about unconventional sexual interests or kind of erotic orientations that might be different from their own, so they can then go out and help folks come out as either kinky or just liking this thing that might be in violation to their family of origin values or kind of a previous religious affiliation. And so they can then assert or express themselves sexually in a way that's authentic and pleasurable and safe. It just, to me, it's just a really rewarding aspect of what I do.